Separators are small blue rubber rings that sit between the teeth to create space for crowns and bands to fit around the tooth. The separators sit below the contact point of the teeth for around 2 weeks before the appliance is fitted. It will feel like you have some food stuck between your teeth, and you can expect the teeth to feel a little bit achy for the first few days. It's really important not to bite down repeatedly or play with the separators, as this can result in them tearing or falling out. Avoid eating any sticky foods that can remove the separators. You may want to eat some softer foods for the first few days. You can brush your teeth as normal, but just avoid flossing in the area where the separators have been placed. If you have lost a separator or it's fallen out, you can replace it by threading 2 pieces of floss through the center as shown. Wrap the floss around the middle fingers for extra grip. Pinch the ends of the floss and stretch like so. Next, gently floss the separator in between the teeth in a backwards and forwards motion. If the space is still present, the separator should just go in easily. Once placed, remove 1 piece of floss at a time while placing your finger over the separator to prevent it from dislodging while removing the floss.